We brought Peter here because we thought that this new assessment unit, which has just been opened, could give Peter the full benefits of its services, and also he would get the best medical attention possible. And we're hoping that with this general assessment it will help him in the future, generally with his schooling, and also, as he is now 8.5, he definitely needs some help educationally and also medically.
The facilities the centre has for helping people like the Robertshaws are undoubtedly impressive. There are numerous playrooms, chock full of every kind of game and toy, and everywhere the atmosphere is informal and relaxed. It was the aim of the planners to create a real home from home, and it's this which makes the centre unique. For the first time anywhere in the world, there's a centre for helping not only the child, but the whole family. Here, a dozen families at a time can come and stay for 2 or 3 nights. As far as possible, the accommodation is arranged in suites, rather like a hotel. This avoids splitting the family up, and throughout the stay, they can get almost 36 hours of uninterrupted help and advice from the experts. A family with one spastic child can face enormous tensions, even if outwardly all seems normal. It's almost impossible for there to be too much encouragement, help and understanding. A good deal of the centre's work is already based on group therapy. When families arrive, the parents are encouraged to discuss their problems with each other, and it was after one such session for parents that I asked Mr. Austin Robertshaw what he had found to be the main problems in bringing up his 8-year-old son.
I think the main problems have, certainly in the initial stages, were those of behaviour difficulties. We perhaps in the early stages didn't appreciate the reason for this because we were not conscious of the degree of subnormality. This became apparent when he first started to attend a special school, and the behaviour problems there were quite pronounced. At that time he was emotionally disturbed as well, and it was at this stage that we realised that we had a somewhat greater problem on our hands than we had at first thought.
What difference has this made to your personal lives, your relations as a husband and wife? I mean, every married couple has its ups and downs. Have you had more downs than you might have done otherwise, do you
No,
think?
we haven't. I honestly think, if anything, it has helped to unite us. The only member of the family who has a slight difficulty at the present time, largely because of her age, I think, is my daughter.
How have you avoided the temptation that you must have had to favour Peter and perhaps not neglect, but not worry so much about your daughter?
This has been a very difficult problem, and if only for the reason that Peter inevitably has needed more care and attention, and we've had to try and compensate in what way we could towards his sister Valerie. But this is one of the big problems, there's no doubt about that.
Certainly in Fitzroy Square, there are no long waits in drafty corridors and hasty interviews. They are out.
The families come particularly the children particularly come with their families because they want an opinion about the child's future, what's the best training, schooling, any sort of further thing that could be done to help. And at this time is a very crucial time for the family. They're very worried what the opinion's going to be, whether there is more that can be done.
Not only the young child that you're dealing with.
Oh no, we have adults come here for chats or for some help or assessment. We have, last weekend we had 6 couples who were both partners handicapped. 3 of them had children, and they were talking about the problems of setting up in married life together and of having children and coping with the little ones.
The children will be perfectly normal?
Oh yes, these children were perfectly normal, and they gave their fathers and mothers a bit of a time. As one dad very sort of warmly said, you know, when Sean doesn't want me to catch him, he takes my sticks away.
Now, you've stated a very wide range of problems that you do have to tackle. What are you able to do about them? I mean, is there in any sense a cure for a spastic, or can you only hope to improve their situation?
Well, yes, there isn't a cure in the sense of making it absolutely right. The thing is to improve matters, either medically, with physiotherapy, with special teaching techniques, or hearing aids, anything that can be put in that's extra needed. But also, the thing that we do, and I'm particularly concerned with, and the social workers, is to take some of the pain out of it and create conditions where children and adults prosper and flourish.
All sorts of things can help, but the main problem facing a psychiatrist like Dr. Goff is to get the patient to trust him. And it's the same problem for other members of the medical staff, like the occupational therapist.
Look, watch, magic. You watch, Mum.
Oh, that's jolly good, isn't it?
Velcro.
Yes,
I
it is a
can
problem
let you have some.
doing up buttons
Yes.
and undoing them,
And
isn't
this
it?
help them to become independent. You just press it together.
Press it
Does this
together.
fit you?
Today is something what they both did on the go.
If ever a job required infinite patience, tact and understanding, then surely it's this one, when there's obviously sympathy and understanding, but an apparently insuperable problem of simple communication. Yet there's no doubt that at times it can be infinitely rewarding.
Everything can off the
You're not trying at
and
all.
off the cobalt.
You're not trying at all, are you?
Off the cobalt.
Push, that's it.
You've spent a couple of days here at the family centre. What's happened to Peter during that time?
Well, he has seen the psychologist and the doctor and the family consultant doctor, and we have been seen by the doctors as well, and we had a good general talk about Peter's whole case and how it affects the family as a whole.
Do you think you've learned anything that you've benefited from your stay here?
I'm sure that we have, yes. We now appreciate to a greater extent than when we first came here the measure of Peter's difficulties. Some new light has been thrown on them of which we were not ourselves conscious, and this enables us to see the problem more in the whole, so that we have found it a great benefit. There's no question about this at all.